A previously healthy 67-year-old female collapses in the parking lot of a supermarket. A bystander initiates cardiopulmonary resuscitation, that is chest compression without breathing, until the medical technicians arrive, the EMTs, and they check the rhythm. The initial rhythm is ventricular fibrillation. I'll show you that in a moment. The patient is shocked, and her heart rhythm returns to normal sinus rhythm. And, of course, she's transported to the nearest tertiary care hospital. So she has a possible syncopal episode. It turns out actually to be a cardiac arrest. And she has a completely irregular heart activity, which is not effective in maintaining the blood pressure. And here is a typical example of ventricular fibrillation. This is not an effective heart rhythm. The blood pressure would be close to zero. So if untreated, eventually this becomes a flat-line EKG and the patient dies. And so she comes to the hospital, and here is her EKG. And for her, this is fortunate. It shows an acute inferior wall myocardial infarction. That is, we see there's ST elevation in leads 2, 3, and AVF. There are reciprocal changes in 1 in AVL, telling us that the ST elevation is the real thing. And she even has some involvement of the right ventricle. A right ventricular lead 4 shows a little ST elevation as well. So this is a fairly substantial inferior wall myocardial infarction, and she has some right ventricular involvement. So she's taken urgently to the cath lab. Her right coronary artery is obstructed and is opened using a drug-eluting stent. She's admitted to the intensive care unit, placed on total body hypothermia for 24 hours. And, of course, we're breathing for her. She's intubated. She's sedated. And, of course, the ventilator is doing her breathing. After 2 days of hypothermia, she's gradually rewarmed, and the patient is weaned from the hypothermia device and gradually weaned from the ventilator, and she gradually wakes up and is found to be, fortunately, neurologically intact. This is very fortunate because this occurs only in about 20% or even less of sudden cardiac death events. The good news for her was that somebody in the parking lot at the supermarket knew how to do CPR, and that probably accounted for her good neurological outcome. Eventually, she's now had her right coronary open. She's put on a beta blocker, an angiotensin receptor blocker, aspirin, clopidogrel, and a statin. And an electrophysiology expert is consulted, decides this patient does not need an implantable cardioverter defibrillator because her VF was the result of an acute myocardial infarction. And so, therefore, it isn't that she has poor left ventricular function. In fact, her left ventricular function turns out to be normal, 65% left ventricular ejection fraction. Cardiac rehabilitation nurse begins ambulation, and after 2 days of successful ambulation, patients transferred to an inpatient rehab center for physical therapy, and in 2 weeks she returns to the outpatient clinic for cardiology follow-up, and she does well in the long term.